The diaphragm is a thin musculo-tendinous structure. The word diaphragm is actually derived from the Greek word diaphragma, meaning partition. Why partition? Because diaphragm separates the thoracic and abdominal cavities, so acts as a partition between them. Well, it closes the inferior thoracic aperture, and the structures that need to pass through it do so through the holes present in the diaphragm, known as hiatus. I will be explaining them in a while. If you have a look at this lateral view of diaphragm, you will find a clear resemblance to an inverted bowl. Interesting is that the levels of the diaphragm vary with the phase of respiration, the posture, and the degree of distension of the abdominal viscera. If you are sitting or standing, your diaphragm is lower, but it is higher in the supine position and even after a large meal. Well, the interior view of diaphragm clearly shows that it has two domes, the right and the left one. The right dome is slightly higher than the left one. Left dome may reach the lower border of the fifth rib, while the right one may reach the upper border of the fifth rib. What can be the reason for this? Well, that's because of the large size of the right lobe of the liver. Now, the diaphragm, is the primary muscle of respiration. While inspiration, it contracts, expanding the thoracic cavity, thus increasing the thoracic volume and decreasing the intrathoracic pressure as a result, which in turn causes the air to rush in. On the flip side, opposite happens during the process of expiration when the diaphragm relaxes. Well, the diaphragm consists of a central tendon and a peripheral muscular part. If we have a look at the peripheral attachments of the diaphragm, anteriorly, it is attached to the xiphoid process of the sternum, here, and the costal margin of the thoracic wall as well. On the lateral sides, it is attached to the ends of 11th and 12th ribs, as you can see here, while posteriorly, it makes its attachment to the first three vertebrae of the lumbar region, L1, L2, and L3, and from medial and the lateral arcuate ligaments. This attachment of diaphragm to the vertebrae is by the tendinous structures shown here, called the crura. Crura is plural for crus. So, there is a right crus and a left crus. The right crus arises from the bodies of the upper three lumbar vertebrae, L1, L2, and L3, and the intervertebral discs, while, on the other side, the left crust arises from the first two vertebrae, L1 and L2 only, and the intervertebral discs. Now, we saw that lateral to the crura, the diaphragm arises from the medial and lateral arcuate ligaments. Now, the medial arcuate ligament is actually the thickened upper edge of the psoas fascia that passes between the body of the first lumbar vertebra and its transverse process, while the other one, the lateral arcuate ligament, is made up of fascia, which overlies quadratus lumborum. From the transverse process of L1 medially to the 12th rib laterally. Now, there's also a fibrous arch that crosses over the aorta and connects both the left and right crura. This is what we call median arcuate ligament. Now, from these peripheral attachments, the muscle fibers converge to join the central tendon, which is shaped like three leaves. And this central tendon lies at the level of the xiphisternal joint. That is, the joint between the xiphoid process and the body of the sternum. Well, the domes support the right and left lungs, whereas the central tendon supports the heart, present in the middle of the chest. Now, that you know about the structure of diaphragm and its attachments, let me remind you of hiatus. Well, I mentioned earlier that there are some openings in the diaphragm, through which various structures make their way from thoracic to abdominal cavities, and vice versa. There are 3 major openings and many more minor openings, but our concern here are the major ones. So, there are 3 major openings. The caval opening, this one in blue. You can guess from the word caval that vena cava passes through it. It lies at the level of the 8th thoracic vertebra in the central tendon and transmits the inferior vena cava and terminal branches of the right phrenic nerve. Other one is esophageal opening, because esophagus makes its way through this opening. It lies at the level of the 10th thoracic vertebra in a sling of muscle fibers derived from the right crus. It transmits the esophagus, the vagi, that are the right and left vagus nerves, the esophageal branches of the left gastric vessels, that are both gastric arteries and veins, and the lymphatics, from the lower third of the esophagus. And lastly, the 3rd major opening we have, aortic hiatus, shown in red. This hiatus is for aorta. It lies anterior to the body of the 12th thoracic vertebra and between the crura. It transmits the aorta, the thoracic duct, and the azygous vein. You can memorize these structures passing through the aortic hiatus by a pretty cool mnemonic. At T12, it's red, white, and blue. What? Didn't get it? Let me help you out. Aortic hiatus lies at the level of 12th thoracic vertebra, so T12 refers to 12th thoracic vertebra, as known as T12. Now, aorta carries oxygenated blood, so red refers to aorta. White refers to thoracic duct, because it carries lymph. That is usually white in color. And, obviously, veins carry deoxygenated blood and are depicted by blue color. So, blue is for azygous vein. So that was about the openings in the diaphragm. Now, you must be thinking right now, what if I end up mixing these? Worry not, because I have another famous mnemonic for you, and that is, I ate 10 eggs at 12. I ate is for caval opening, where I is for inferior vena cava, and 8 is for 8th thoracic vertebra. 10 eggs is for esophageal opening, where 10 is for 10th thoracic vertebra, and eggs is from esophagus, and vagus. Also, vagus nerve is the 10th cranial nerve, so you can remember it as T10 for 10th cranial nerve. And lastly, at 12 is for the aortic opening, where A is for aorta and azygous vein, T is for thoracic duct, and 12 is for 12th thoracic vertebra. Another way to remember these is by counting the alphabets in each word. Vena cava has 8 letters and passes through diaphragm at the level of T8. Esophagus has 10 letters and passes at the level of T10, while aortic hiatus has 12 letters and lies at the level of T12. I hope now you will never jumble up these openings in the diaphragm and the structures passing through them. Well, you must be tired now, right? So, take a deep breath and head on to the last part of the video. That is about the neurovasculature of the diaphragm.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.